cancer has become the #1 killer in recent times. According to estimates, there are about 90 to 100,000 people living in Malaysia with cancer. The National Cancer Registry of Malaysia, NCR, records more than 21,000 Malaysians who are diagnosed with cancer every year, but estimates that almost 10,000 cases go by unregistered. It is estimated that 1 in 4 Malaysians will develop some form of cancer by age 75. The following shows a breakdown of different types of cancer that affect the Malaysian public. Breast cancer, colorectal cancer, lung cancer, cervical cancer, nasopharyngeal cancer. So the question frequently asked by everyone is, can cancer be detected at an early stage? Today, there are many tests in the market that lay claim to this. But the more prominent and certainly most effective method is the CTC test.
CTC stands for circulating tumor cells. It is also known as liquid biopsy. This test is done by a very simple procedure of drawing your blood from the vein, about 20 cc, where you can count the number of cancer cells that are floating around. And most of these cancer cells, or all of these cancer cells that are actually floating in your circulation, are the stem cells, cancer stem cells. And these are the cells that are responsible for the secondary growth, or what we call as metastasis. Most patients do not die of the primary cancer, but they die of complications from the secondaries or metastasis. So it's very important to identify these cancer stem cells. So the benefits of CTC is that it offers the earliest possible diagnosis of cancer. It picks up cancers at about 0.5 mm, whereas all conventional diagnostic methods currently available only pick it up at 5 mm and above. Now this is a very important benefit for early diagnosis, because the outcome depends on early diagnosis. And number 2, you can use CTC to monitor the progress of any treatment, leave it be conventional treatment or any natural methods of treatment, because the repeat test, which is again by a simple blood test, tells you whether the treatment has been effective by reducing the number of circulating tumor cells. Now, a big benefit of CTC is also in the sensitivity test, which means you can test the sensitivity of chemo drugs or chemotherapeutic agents, and also natural agents like vitamin C and curcumin, to assess whether such treatment will actually work or will not work for a patient. So that treatment is scientific and evidence-based, based on sensitivity and not a blind shot.
The CTC test is conducted in Malaysia by DR.DNA Diagnostics, Sdn Bhd. Established in 2013, DR.DNA Diagnostics partners with fully accredited medical laboratories as well as health agencies, including the Centre for Medicare and Medicaid Services, which oversees clinical labs in the United States and Germany. Under the Federal Clinical Laboratory Improvement Amendment, CLIA, DR.DNA Diagnostics team promises to be the best provider of comprehensive and innovative clinical laboratory services for the prevention, diagnosis and treatment of complex chronic diseases. For more information, please contact Mr. Anand at 012-745-5093 or visit our website at www.drdnadiagnostics.com. Cancer strikes at any age. Save your life with early detection and screening. Act now.